Good afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So now we'll discuss about the group therapy. So basically, working in group induce the conversation and laughter, which definitely induce the relaxation of the mind and also the body, which is definitely essential for effective rehabilitation. And there are many patients where the introduction of the group exercise at a planned appropriate time is psychologically uplifting because it represents the achievement of the new goal. So in the group, the therapist's attention definitely will be shared. So giving patient more responsibility for their own achievements and when they are exercising, and for their own management when dressing or undressing. And it may even inspire them to give help to those who are less dependent than themselves. So in this way, their confidence is boosting. What is the concept? So definitely it is a safety first approach and properly installed apparatus in accordance with safety regulation. So definitely the gym person should be punctual, in proper dress, and not more than 8 to 12 in a group. So the therapist should know every patient by their name. So it comes under teaching technique. Voice, positioning, starting position, order, help advice, observation, termination, or it should not exceed more than 30 minutes per day, and there should not any kind of frequent changes in the exercises, and the exercise program should be carefully planned, which ensure that the injured part of the body return to highest degree of function. And one should avoid fatigue because resting period gives some time for recovery, which is essential. Then what are the apparatus? Like there's a fixed apparatus, like it should be installed by the experts, and then there should be movable apparatus, large, small, which can be placed in the joint area. And also there is an apparatus involved in an accident should be retained for the inspection. Then people in the gymnasium, like they include both patient and therapist. So both should be punctual, well dressed, and the number of patients in any group should not exceed 8 to 10 or 12, and therapist should know the each and every person with their names, because it is a group therapy. Only 8, 10 or 12 people are allowed only. So therapist should know, and it would be easy for him or her to know everyone by their name, because it is not a mass exercise. And there is a danger in teaching an anonymous patient, as they cannot be protected from individual hazards. So therapist should be sure that patient knows his or her name. So these are the few figures or pictures showing the group exercises. What is the journal teaching technique? So definitely apprehension is an essential ingredient of good teaching. Teaching firmly and positively, but not aggressively. We can help students achieving their best, and it is not easy and often feels rude and abrupt not to use these phrases in the early stages of the learning to take a group, because there are so many students who are frightened or they are in pain, so they must be given a hint so that they may fail to uh, do what they are asked to do. The next, we correct use of the voice is an important factor and ensuring the measures of the group activity, and it should be stimulating, portray enthusiasm, enjoyment, and most carefully planned exercises may be rendered ineffective by poor work delivery. Then we have positioning. Then positioning and therapy should be such that observation of expected difficulty is easy. Movement of therapist, any part of the patient or apparatus should not present danger. And patient who have special problem, example deaf or blind, it should be positioned where they can most people from is from the group. Teaching and exercises that is teaching should be done with the experience of therapist, and this doesn't necessarily mean that the patient must be able to give a perfect demonstration how she or he is at least aware of potential difficulties. Then there are 4 clear stages in the teaching an exercise. Then starting position, exercise कौन सी करानी है, termination and observation and correction. So definitely child should focus on what would be the starting position. Then next exercise, which exercise is to be performed by the patient, and definitely taught by some boards and demonstration or combination of both. And then help, advice or encouragement which should be given to the patient so that he or she can improve his or her. And the exercise should finally be brought to close when the deepest feels that the time is appropriate, not when the patient feels like it. Observation and correction, it's very important to always teach the patient to avoid necessity of correct, and teacher should change her position and in relation to group according to fault and exercise is likely to present, but any movement should be for a purpose. Then should be a patient oriented medical report, and there should be patient oriented medical record, and individual problems are defined, objectives had laid down so much they are easily, or we can say easily understood by the patient, should be monitored at the regular intervals.